In this video, we'll break down exactly what each of these waves mean, step by step. By the end, you'll see the EKG in a whole new way. Let's dive in. Meet your heart's natural pacemaker, the SA node, located in your right atrium. It generates an electrical signal that starts each beat, typically 60 to 100 times per minute. This impulse spreads through your atria, causing them to contract and pump blood into the ventricles. On the EKG, this atrial contraction is represented by the very first bump, the P wave. The P wave shows us atrial depolarization, or simply the atria contracting. But here's a fun way to remember potential issues. Your P wave can be peaked, prolonged, or poof, gone. Peaked P wave? Think right atrial enlargement. Prolonged P wave? Think left atrial enlargement. Poof? No P wave. Think atrial fibrillation or SA node failure. Normally, the P wave should last about 0.08 to 0.1 second. Any longer might mean the signal is moving slower than it should. After the P wave, the electrical impulse pauses briefly at the AV node. Think of this as your heart's chance to pause and reflect. This pause is crucial because it lets your ventricles fully fill with blood. Normally, this pause, the PR interval, should be between 0.12 and 0.20 seconds. Longer could indicate a heart block. Shorter could mean the impulse found a shortcut, like in Wolff-Parkinson's White syndrome. Next, the impulse quickly moves into the ventricles, causing them to contract. This rapid, powerful event is represented by the dramatic spike called the QRS complex. Remember the mnemonic? QRS stands for Quick Rapid Squeeze, and it happens in just 0.06 to 0.1 seconds. If the complex widens, it could mean a blockage or slow conduction within the ventricles. After the ventricles contract, they need a moment to recharge. This recovery phase is repolarization, represented by the gentle curve of the T wave. Think of this as your heart's moment to take a breath and reset for the next beat. The T wave is part of a larger interval called the QT interval, lasting roughly 0.36 to 0.44 seconds. A prolonged QT interval can signal risk for dangerous heart rhythms, making it an important part of the waveform to watch carefully. So, let's recap. The SA node fires, P wave. The signal pauses at the AV node, PR interval. Then rapidly moves through the ventricles, causing contraction, QRS complex. And finally, the ventricles reset for the next beat, T wave. This perfectly timed cycle repeats again and again, keeping you alive every moment. Now that you understand the EKG waves and the heart's electrical dance, we're ready to take it to the next level in our next video. Be sure to like and subscribe so you don't miss out on the next one. Thanks for watching.